morning, ladies and gentlemen. Welcome to the NCIS Rebel Challenge 2021 Cancer Awareness Talk. My name is Ivy Lim. I'm the host for you this morning. We were just wondering, if we have any familiar faces that's participating today. If you have been to any of our NCIS event and you've seen me before, maybe at the Q&A box at the bottom, you can put in a 1. And we can see that, we have some familiar faces. It'll be good to know that old friends are in with us, joining us this morning. And for those of you who are joining us for the first time, NCIS, thank you. I see a lot of familiar faces. Welcome back. Welcome. Thank you. It makes the day well, really. Thank you so much. So for those of you who are joining us for the first time, NCIS is a National Specialist Center under the National University Health System, NUHS. It is the only public cancer center in Singapore that treats both pediatric and adult cancer patients through its facilities located at the National University Hospital. NCIS also provides cancer services through partners like Ng Teng Fong General Hospital, Alexandra Hospital, Jurong Medical Center, and Tan Tock Seng Hospital, and extends services to patients at home and in the community. Our comprehensive and personalized services include screening, diagnosis, treatment, and supportive care. The NCIS Ribbon Challenge started in 2018, and this year is the first time we are organizing the event virtually to keep everyone safe. Themed as Together We Fight Cancer, we aim to increase cancer awareness, emphasize on the importance of maintaining a healthy lifestyle and going for regular health screenings. We also hope to heighten cancer awareness among our loved ones. So what you hear today, spread the news. And if you don't think you get it really right, come back or encourage them to get their screening. We also hope that when we encourage those battling the disease alongside their caregivers, as well as to express gratitude to our healthcare workers. So we are glad to be able to bring to you a series of interesting activities and public forums virtually. First, collection of ribbon badges. Head over to www.ncisribbonchallenge.sg and send a ribbon of hope and encouragement to a cancer warrior. Maybe someone could type it into the Q&A box so our viewers or those attending could see the link, www.ncisribbonchallenge.sg. Send a ribbon of hope and encouragement to cancer warriors, survivors, or even the healthcare staff to show your support for them during this exceptional period. Then spread the word by sharing your ribbon on your social media account, #NCIS Ribbon Challenge. And you may stand to win a useful, and we emphasize useful mystery prize daily by sending your pledges. So show your support. And when it says that, Muhammad doesn't come to the mountain, we bring Muhammad to the mountain. But a mammogram screening at Mammobus. So to further emphasize the importance of health screening, Mammobus will be located at NUH Medical Center, Zone A, at the Level 3 drop-off point outside Burger King on 21st March to carry out mammogram screening for ladies above the age of 50 years. So why wait? We're bringing it to you, and you should try to book your slots, and slots are limited. No more excuses. Your screening is now right at your doorstep. Singapore Cancer Society Fit Kit Collections. Next we have is Singapore Cancer Society, also known as SCS, will be distributing fecal immunochemical test kits, which we call them FIT in short, at no charge to those who are aged 50 years and above. The FIT kit is a preliminary colorectal screening cancer kit that detects the presence of small amounts of blood in your stool. It is a sample that, simple test that you can collect a small sample at home at the comfort of your house and to send them back by post. Now visit their website at www.singaporecancersociety.org.sg or scan the QR code, which is now on screen, to find out how you can collect the feed kit today. And you may be able to get more information too on how you can collect the sample, knowing our toilet is these days is different, and we will give you all the information that's necessary. I repeat, scan the QR code and you'll find out more on the collection of this feed kit. This is a pre-screening for colorectal cancer. As we mentioned earlier, we are bringing you more talks virtually. Announcing up next is in conjunction with Colorectal Cancer Awareness Month, there will be another webinar on the 27th of March 2021. It is Preventing Colorectal Cancer. If you are interested, again, scan the QR code, which is on the screen now, or visit NCIS website at www.ncis.com to find out more. Colorectal cancer is actually very preventable if you have done the test or kit or have pre-screening. So we encourage you, and again, it is a webinar. We would like to take the opportunity also to thank our participants, or our partners, which are Singapore Cancer Society and 365 Cancer Prevention Society, as well as sponsors MSD Pharma, Pfizer, Roche, and their generous support for this event. Before we begin the program, we would like to highlight some pointers. Your microphone is mute by default. If you have any questions for our speakers, please use the Q&A box, and our specialists will answer them live during the Q&A segment. This session is being broadcast live on Facebook page of National University Cancer Institute Singapore, Singapore Cancer Society, and 365 Cancer Prevention Society. You may also visit their website or their Facebook page to attend this talk. And lastly, we would greatly appreciate if you can 2 to 3 minutes to take the time to fill the feedback form at the end of the webinar. So don't click leave immediately. After the session, the questionnaire will be live. It's like a poll. Just answer a few questions. Your feedback is important to us. We would also like to highlight that not all the questions will be answered, but we will try our very best, depending on the time permit, to answer as many questions as we can. Are you all ready? Without further ado, let us welcome our first speaker of the day, introducing Dr. Nisa Kumara Kulasinghi, our Associate Consultant from the National University Cancer Institute of Singapore, Department of Hematology Oncology. Dr. Nisa will be sharing about understanding cancer, its myths and prevention, which also includes some of the myths about cancer and cancer prevention. Over to you, Dr. Nisa.
Hello, good morning. My name is Nisa. I'm an oncologist from NCIS. Thank you very much for the opportunity to be able to speak to you today, and I'm pleased to meet you all online. Without further ado, I'll start my talk for today. I'll just share my screen. So today's talk is called Understanding Cancer, Its Myths and Prevention. So the outline of the talk will start off with what is cancer, local statistics about cancer, common myths about cancer, and risk reduction tips and screening. So what is cancer? Cancer is a group of diseases that occur when abnormal cells multiply uncontrollably, creating a cluster of cells called a tumor. And these cancerous tumors can spread to nearby tissues and other parts of the body. And there are more than 200 types of cancers which are all treated differently. Now, early diagnosis can often make a big difference into how cancers are treated and making a better chance of recovery. Now, how common is cancer in Singapore? Between the years 2010 to 2014, up to 60,000 cases were diagnosed. And that comes up to an average of 34 cases per day. Now, the most common cancers in females are breast cancer, colorectal cancer, and lung cancer. And in males, it is colorectal cancer, lung cancer, as well as prostate cancer. Now, As I mentioned previously, breast cancer is the most common cancer in females, with up to 1 in 3 females having breast cancer in their lifetime. And in colorectal cancer, 1 in 6 males. Lung cancer is the most lethal of the cancers, and up to 80 to 90% of patients may pass on within 5 years of the diagnosis, depending on the stage. We'll go into some cancer myths, and there will be some questions which you can just test yourselves. The first one is, only men should go for colorectal cancer screening. Is this true or false? What do we think? It's actually false. We know that colorectal cancer can affect both men and women, and it's the most common cancer diagnosed in Singapore for men and women combined. If you look at this report from the Cancer Registry, it shows that colon cancer is the #1 cancer in males, and it's the #2 cancer in females. So this means actually both men and women should go for colon cancer screening. Second question, the radiation from regular mammograms will cause breast cancer. Is this true or false? What do we think? The answer is false. While mammograms does use radiation, it's a very small amount, and the dose of radiation from a mammogram is about equivalent to 2 months of background radiation from the environment for the average woman. Third myth, cancer only affects the elderly. What do we think about this? Is it true or is it false? It's false. It can affect all age groups, as we can see. And as you can see in this chart, although the incidence is highest in patients age 64 and above, there's a significant number of patients who are young, between 35 and 64, who develop cancers, and also patients in the younger age group, between 15 to 35, do develop cancers, just as differences in the types of cancers that these patients get. Now, the next question, cancer diagnosis is a death sentence. Is this true or is this false? Many of you may know cancer survivors in your personal lives, and this is actually false. It's not a death sentence. And we know that although it's #1 cause of deaths in Singapore as compared to other types of diagnosis, we know that the death rate from cancer is actually on the decline in Singapore. If you see from 1968 to 2017, there's a clear decline in the mortality from cancer, which is very encouraging. And also the type of cancer determines the survival and what the prognosis is. If you look at all cancers in general, the 5-year survival is about 70%, all stages included, and also depending on the type of cancer. So patients with prostate cancer have generally a better outlook than patients with pancreas cancer, who have a very poor 5-year estimated survival. This is a popular one. Eating sugar will make my cancer worse. What do we think? Is this true or is this false? It's actually false. So although research has shown that cancer cells consume more sugar or glucose, we could say, than normal cells, no studies have actually shown that eating sugar will make your cancer worse, or that if you eat or you stop eating sugar, that your cancer will shrink or disappear. So in general, everything we advise in moderation, but eating sugar does not make your cancer worse. How about next one? Cancer is mostly due to genetics, and there's nothing we can do to prevent it. Is this true or is this false? As you can guess, it's false. There's no sure way to prevent all cancers, but there are several steps that we can take to lower our risk and screen for early cancers. So what causes cancer? There's no single exact cause of cancer. It's a combination of genetic and environmental factors. And there are factors that we can change, which are important, because we can't change our genetics, but we can change things and factors in our environment. So things we can do, we can not smoke, consume alcohol in moderation, have a healthy and balanced lifestyle, exercise regularly, have good, prevent excessive sun exposure, and prevent infections which can lead to cancers. We'll go into these risk factors one by one. Now, the best thing you can do to prevent cancer is to never use tobacco products, or stop if you're using. Tobacco causes 14 types of cancers, and these are just cancers and not talking about the other chronic illnesses that smoking can cause. So what you should do is stop smoking. If you find this difficult, at least start to reduce and eventually quit. And you can get professional help with this. How about e-cigarettes? Actually, the long-term outcomes are still being investigated, but there's actually no safe tobacco product. All tobacco products have a risk of nicotine addiction and do contain toxic cancer-causing chemicals. So even e-cigarettes will advise against it. Now, if you are a smoker, there are hotlines and there is support, and there's also medications, nicotine replacement that can be considered to help you quit. The next risk factor is alcohol. To prevent cancer, you should drink in moderation, and men no more than 2 standard drinks a day and women no more than 1. And there is help available if you have some difficulty reducing your alcohol intake. Alcohol causes cancers in many different sites in the body, from the mouth all the way to bowel cancer. And what is a unit of alcohol? And a large glass of wine is just under 3.5 units. So you should not have a glass of wine every day, a large glass of wine every day. A small glass of wine may be okay for men. Okay. Now, definitely food is an important risk factor for cancer, and Dr. Lim will be speaking on this in her presentation later. So we'll carry on to the next risk factor. Now, it's recommended that we have at least 150 to 300 minutes of moderate intensity exercise per week. And this is also true for children, and this helps to prevent cancer in the long term. To avoid risk factors, for example, excessive UV exposure, which is in sunlight. So, and we know that Singapore, being on the equator, has the highest rate of UV exposure. What we can do is to use sunscreen, prevent sunburns, and definitely avoid tanning and tanning beds. Okay. And some infections can actually cause cancer. For example, hepatitis B and C. And with the introduction of the vaccination program in Singapore, that has significantly reduced the occurrence of Hep B in Singapore. But also other infections like human papilloma virus can also cause cervical cancer, and vaccination is recommended. Okay. And HIV infections can predispose to a number of different cancers, and hence practicing safe sex is strongly recommended. Next, we go into cancer screening. Why go for screening in the first place? Mainly, if a cancer is diagnosed in the early stage, there's a better chance of cure, and you actually need less treatment if you go for early screening and you find a cancer in the earlier stage. And screening, importantly, helps to detect cancers before they cause symptoms. Okay. Now, there are 2 types of screening in general. There's the general population screening, which consists of breast, colorectal, and cervical cancer screening, and individualized screening for those who have an increased risk of specific cancers. We'll focus in this talk more on the cancers that affect men, and Dr. Lim in the second talk will focus on screening for cancers that affect women. Okay, and as I mentioned earlier, colorectal cancers affect both men and women. And for colorectal cancer, the screening is done to actually pick up polyps at the earlier stage before they progress in these stages, before they progress to cancer. And this, from a small polyp to invasive cancer, it takes about 10 years. So if you do polyp removal early, you can prevent cancer 10 years down the road. And ways to screen for colorectal cancer, the 2 recommended ways are with colonoscopy and the fecal immunochemical test, the FIT test, as mentioned earlier. A colonoscopy allows us to see directly the entire colon and allows for also removal of polyps at the same time. So that's the benefit of it. And also a normal colonoscopy means that you only need to repeat it in 10 years, okay, as opposed to the FIT test. The limitation is that you need full bowel preparation, so you need to take the medication to clear the bowels to allow the surgeon to be able to look inside the colon. There is a little bit more risk, small risk of bleeding or infection and injury to the bowel during the procedure. The alternative is the fecal immunochemical test, which is the non-invasive method, and you actually take a stool sample and you test for hemoglobin or blood within the stool. And the benefit is that it's easy to do. You don't need to take a day off work, but the limitation is that you need to do it annually for it to be accurate, and it may miss cancers as well. Okay, and it has to be done every year to be effective. Now, for the average risk individual, average risk means that you don't have symptoms, you don't have a family history of first-degree relatives. It's recommended that you either do a colonoscopy or a FIT test from the age of 50 years old. Okay, colonoscopy every 5 to 10 years, and a FIT test every year. High-risk individuals mean that you have a first-degree relative, age 60 or younger, or 2 or more first-degree relatives, or you have cancer in a first-degree relative. These are actually recommended to go for earlier screening and more frequent screening. If you had a personal history of polyps, then you will actually need a repeat colonoscopy 1 to 3 years after the polypectomy. Okay? And very high-risk patients are patients who have known genetic disorders which predispose to cancers. Now, let's go to a bit of individualized screening for prostate cancer. Prostate cancer is screened with the PSA test. At present, it is not recommended for the general population because it is uncertain of the benefit at the population level. For example, if there are 100 people who actually do this PSA test, it may pick up 5 people with prostate cancer, but 20 of patients will actually have a high PSA level. And going through further investigations may cause side effects such as bleeding and infection if the patient requires a biopsy. So at present, it is only recommended for people who have high risk factors for prostate cancer. And these high risk factors are a family history of prostate cancer. If you have known family history of inherited BRCA1 and 2 genetic mutations, your age over the age of 50 after discussion with the urologist, and obesity. Okay. The next cancer screening to tackle is about lung cancer. It's also not recommended for the general population, and the test that is recommended is a low-dose CT scan, and only specific high-risk people should be screened. In Singapore, the Ministry of Health has not given us guidelines for this, but based on the American guidelines, if you have a history of heavy smoking or currently smoking or have only quit within the last 15 years and are between the ages of 55 and 80, it is recommended to go for a low-dose CT scan annually to pick up lung cancer. But this has to be discussed with the physician because it's not part of the general population guidelines. Now, for other cancers, for example, where there are only high-risk individuals that should be screened for, liver cancer, and there's no data to support liver cancer screening in the general population. And those who are at higher risk can be screened with blood tests as well as an ultrasound of the liver. And those who are at risk is if you have chronic hepatitis B or C infections or liver cirrhosis, or what we say hardening of the liver from other causes. So if you have a family history of hepatitis B, it's a good idea to check yourself if you have chronic hepatitis B. And then if you do have it, then you'll be advised to go for screening for hepatitis, hepatocellular carcinoma or liver cancer. Another type of cancer, which is a bit more common in men, is nasopharyngeal cancer. Overall, it's not common. It's just the area behind the nose at the back of the throat. And it affects men more than women in Singapore, and it's the 8th most common cancer. Now, general screening in the population is not recommended, but if you have a family history of nasopharyngeal carcinoma, have a very high consumption of preserved food like salted vegetables, or if you're known to have Epstein-Barr virus infection, these are all risk factors then you would recommend. But what we strongly recommend is if you have a family history of nasopharyngeal cancer, this is the biggest risk, then you would actually go and get a screening for this. And screening is with a ENT examination, where they examine the insides of the nose and the back of the throat. So that's all I had for today. And then I think we will go on to the next presenter before we have the questions. Thank you very much for your attention.
Thank you very much, Dr. Nisa. Thank you very much. Thank you. Introducing the next speaker, we have Dr. Lim Yi-Wan. She is the Senior Consultant from the Division of Hematology Oncology of National University Cancer of Institute. And Dr. Lim will be sharing, who will share with you more than the battle against female cancer prevention and early intervention. Over to you, Dr. Lim.
Good morning, everyone. I'd like to share my slides first, sorry. Can you see my slides?
Yes, we can see it.
Okay, good morning, everyone. It's nice having all of you here together with us on this Saturday morning. I'll be talking about the battle against female cancers, mainly prevention and early intervention. This is the outline of my talk. I'll first be talking about breast cancer and then cervical cancer. Going through some statistics, as Dr. Nisa has mentioned earlier, these are the top 10 cancers in females in Singapore. The commonest is breast cancer, followed by colon cancer and lung cancer. And we have uterine cancer at number 4 and ovarian cancer at number 5. And cervical cancer is actually dropping down the list. It's now number 10 on the list. The breast cancer incidence in Singapore is rising. And this is from the Singapore Cancer Registry from 1970s to now. The incidence is continuing to rise. Whereas the incidence of cervical cancer is actually dropping in Singapore. So it's from 1970s to now. We can see that the graph is going downwards, and that is very good. So the first part of my talk will be on breast cancer. I'll be touching on the risks for breast cancer, what we can do to reduce our risks, and also early detection. So as Dr. Nisa has mentioned earlier, cancer is the abnormal growth of cells. So for breast cancer, the cancerous cells can start in any part of the breast. It can damage the normal tissues and spread out of the breast to other parts of the body. So the first part that we usually spread to is usually the lymph nodes, like the lymph nodes in the axilla or in the armpit area. And with regards to risk for breast cancer, so there are several risk factors that we know that can cause breast cancer. Being female is one of them, increasing age, genetic risk factors, and there's some medical and lifestyle factors that can also increase risks. We know that age is a risk factor. The graph here shows that the incidence starts to increase in women who are like in their 40s. It's further increased in women in their 60s to 70s. And about 5 to 10% of breast cancers may have a genetic factor. And the most well-known gene that's linked to breast cancer is the BRCA gene. So women with close blood relatives with breast cancer or ovarian cancer may be at higher risk of getting breast cancer. You may have heard of the Angelina Jolie story. So she has a family history of ovarian cancer. Her mom had ovarian cancer, and she was detected to have a BRCA1 mutation. Other factors that can increase breast cancer includes, if previous breast conditions, the use of hormone replacement therapy, early start of menstruation, or late menopause. And lifestyle factors, as Dr. Nesa has mentioned, the lack of physical activity, being overweight, alcohol use, and smoking can possibly increase our risk of breast cancer. The protective factors would include childbirth and breastfeeding. So we can certainly do things to reduce our risk of breast cancer. If you have a strong family history of cancer, it is important for you to speak to your doctor to discuss if you would benefit from a referral to a cancer genetics clinic, because there can be steps that can be taken to decrease the chance of breast cancer with patients with increased risk due to genetic factors. And this will include regular and early screening, a discussion about preventive surgery, and some medications. So all women can lower risk by staying physically active, by having a healthy weight, and by limiting use of alcohol and to stop smoking. And for considerations for some women, breastfeeding is a protective factor, and we should minimize the use of hormone therapy when dealing with menopausal symptoms. The next part of the talk will be on early detection of breast cancer. There is no sure way for us to prevent breast cancer, but we can do things to decrease our risk. And early detection is very important, and it will increase our odds of cure. So it is important for the screening to happen even when you feel perfectly healthy, because screening actually detects very small lesions that are limited to the breast. And early detection, as we know, is a key factor if we want to cure the breast cancer. With early treatment, we will get better outcome and also less risk of serious complications from the cancer and the treatment. And the ways to screen for breast cancer would be mammography and also regular self or clinical breast examination. So this is a mammogram. The mammogram is an X-ray of the breast. They will take a picture of the breast tissue by placing the breast tissue between two X-ray plates, and we will get a picture like the one over here. And this mammogram pictures can pick up early changes of breast cancer, what we call the non-invasive breast cancer, by picking up these calcium dots called microcalcifications. And it can also detect small lumps that may not be detectable by clinical exam. In doing clinical or self-breast examination, it can be done by the doctor or by yourself. And the things to look for include lumps, changes in the nipple, like a pulled in or a retracted nipple, or nipple discharge, or skin changes like rashes or dimpling or redness. And so what will happen if your mammogram result is abnormal? 90% of the time, mammogram screenings will have normal results. But an abnormal result does not necessarily mean you have cancer. Further tests will usually be done. And most of the time, the results may turn out to be normal after all. The further tests that will be done include a breast ultrasound, clinical breast exam, biopsy of the lesions, or a repeat mammogram. And breast screening has been shown to work. Studies in the US and Europe have shown that regular breast screening can reduce our risk of dying from breast cancer. The breast cancer deaths may be reduced by 25 to 30% in women in their 50s. And so this will translate into lives saved. So we have a screening program in Singapore. So women 50 and above are recommended to go for mammogram once every 2 years. Those who are 40 to 49 years old are recommended yearly mammogram, and this should be discussed with the doctor. And women in their 20s onwards should start with monthly breast self-examination. And mammogram is widely available. We have it everywhere. We have it at polyclinics, at hospitals, and at the mammo bus. So we come to the second part of my talk, which is cervical cancer. We'll be talking about who's at risk of cervical cancer, anything we can do to reduce our risks, early detection, and prevention of cervical cancer. So cervical cancer is actually the abnormal growth of cells in the cervix. And if you're wondering where the cervix is located at the lowermost portion of the uterus, and it connects the vagina to the uterus. And cervical cancer is actually preventable, and it's one of the most treatable cancers that we have. So who's at risk of cervical cancer? Sexually active women, current and previous, those who never had a pap smear, those who have not gone for regular cervical cancer screening may be detected with cervical cancer, and also those who never had a HPV vaccine. So the risk factors include increased exposure to the HPV virus, that is with multiple sexual partners or sex at an early age, and not being able to get rid of the HPV viral infection. Most people can get infected with the HPV infection in their 20s, but many of the people may be able to clear the infection, but there will be a group of people who are unable to get rid of the HPV infections. Other risk factors include smoking, and being immune suppressed, like patients who've had an organ transplant, some other infections like HIV, or sexually transmitted diseases, and other poorly controlled systemic disease like diabetes have been linked to increased risk. So what can I do to decrease my risk of cervical cancer? So cervical cancer is actually have a very effective screening method, and there is a very effective and safe vaccine that's available. So no woman should be getting cervical cancer if they go for effective screening and also vaccination. So these are the 5 steps to prevent cervical cancer: safe sex, vaccination, screening, looking out for symptoms, and stop smoking. The early detection of cervical cancer is done by using a test called pap smear. So a pap smear is actually a simple test that can be done by taking out some cells from the cervix, and this can be done easily at the doctor's clinic, and the cells will be sent for examination in the lab to look for abnormalities that are either early changes of cervical cancer or early stage of cervical cancer. So Cervical Screen Singapore is our national screening program. So our current national screening guidelines would recommend that women aged 25 to 29 go for pap smear every 3 years, and those who are 30 to 69 can go for HPV screening every 5 years. So in essence, all women between 25 to 69 years should be going for cervical cancer screening if they have ever been sexually active. And pap smears or these HPV tests can be carried out also at multiple places like polyclinics and private clinics and hospitals. And subsidized pap smears are available at all polyclinics and designated centers. And why is pap smear screening helpful in reducing cervical cancer? Cervical cancer actually takes many years to develop, from the pre-invasive stage to the cancerous stage. So, so pap smears actually can detect these very early changes in the cervix that are in the pre-invasive stages. And if detected early, cervical cancer is actually very treatable. And actually, most invasive cervical cancers are found in women who actually have not had regular pap tests that would pick up these changes earlier on. We do know that the survival from cervical cancer actually is best when it's detected at the very early stage. For stage 1 cancers, we can expect a 5-year survival rate of 80 to 90%, whereas this decreases as the stage increases. So it's important that we detect early, treat early, and so do not delay going to see your doctor. You may be asking about the symptoms of cervical cancer. We may have no symptoms at all at the early stage, but some of the symptoms to look out for include prolonged heavy menstrual bleeding, bleeding between or following periods, post-intercourse bleeding, pain or during after intercourse, increased vaginal discharge, bleeding after menopause, or a persistent pelvic pain. Having these symptoms does not necessarily mean that you have cancer, but you have to consult your doctor early for a check. So, is there anything that we can do to prevent cervical cancer? Yes, there is. we need to know about the human papillomavirus. The human papillomavirus, actually, there are more than 100 types of human papillomaviruses, also known as HPVs, and some of them are harmless, but there are certain types that are linked to cervical cancer. And the type that is linked to cervical cancer, the high-risk types include type 16 to 18, which is responsible for about 70% of cervical cancers. And the less common high-risk ones, which include the HPV 31, 33, and 35. And there's also HPV 6 and 11 that's been known to cause genital warts. We have now a HPV vaccination available, and it will prevent the HPV infection and also the development of precancerous changes known as CIN. So we have 3 types of vaccine that's available in Singapore. We have Gardasil, Cervarix, and Gardasil 9. So the vaccination schedule is we will get 3 injections over 6 months. For girls who are aged 9 to 14, they only need 2 injections. And this is approved for females aged 9 to 26 years. And actually, there's a vaccination program going on for our girls in secondary school. So please encourage your girls to go for the HPV vaccination when offered in school. And this is recommended before first sexual exposure. But do note that HPV vaccination is not a substitute for cervical cancer screening. It doesn't protect against all HPV types, so we will still need to go for screening. So my take-home message would be, breast and cervical cancers are common in women, and they are modifiable and non-modifiable risk factors for cancer. We can all try to decrease our risk of cancer, and screening and vaccination is vital, and early detection saves lives. Here again is one screening recommendations: a mammogram for women, cervical cancer, pap smear, and HPV test screening, and also colon cancer screening, as mentioned by Dr. Nessa, for those age 50 and above. Thank you.
Thank you, Dr. Lim. Thank you very much. And to step on what you have just said, we'll follow up with this is that, again, we remind everyone there's a memo bus coming up, on the 21st of March to carry out mammogram screening for ladies above the age of 50. And you can find this memo bus located at NUH Medical Center, Zone A, at the level 3 drop-off point outside Burger King, again on the 21st of March. So, do take the opportunity and have a screen. Thank you, Dr. Lim Yuan. And next, we're welcoming another Dr. Lim to talk about the relationship between cancer and diet. Welcoming our next speaker, Dr. Lim Siu Eng. She is the Senior Consultant of the Department of Hematology Oncology from the National University Cancer Institute. Dr. Lim will share with you the relationship between cancer and diet, the hottest topic every time. And I think we already received many questions regarding what we eat and what happens to us. Over to you, Dr. Lim. Thank you.
Thanks, Ivy. Good morning. So I'm going to talk about cancer and diet. So having an unhealthy diet, being overweight, is associated with many bad diseases, one of them being cancer, stroke, heart disease, high blood pressure, and diabetes. So all this we call chronic disease, and they are bad diseases. So we'll just quickly go through the bad list. So don't drink all the high sugared drinks. Don't eat all the biscuits and the little cakes that we love. This makes you fat, obese, and overweight. Don't eat so much red meat, beef, pork, goat, lamb, and avoid processed meats. And you should eat about 18 ounces of meat a week only. And pork is, although it looks like white meat, is actually counted as red meat. And don't eat all the processed meats if possible. Okay, these are our local favorites: pork luncheon meat and Ramly burger. Before there was McDonald's, some of us used to eat it also. So the world says if you eat 50 grams of processed meats daily, you can increase your colon cancer risk by 18%. And then how you cook your meats is also important. So when your mother told you that all the black bits on your barbecued meat is no good, she's correct. So I don't know if you scrape off the black bits, whether that makes it better, but just watch how you grill your meats. And these bad chemicals, these carcinogens that can increase your risk for cancer, is formed when the fat drips off the meat into the flames. The other thing you should try and limit is, of course, limit salted foods. Salted foods is associated with stomach cancer. How much salt are we supposed to take? Only 1 teaspoon for the whole day. And if you're someone who wants to substitute your salt, soya sauce is not the salt substitute. That's also a lot of salt. So you try and use it with herbs: rosemary, turmeric, basil, ginger, lemongrass. Use it with sweet vegetables, celery, onion, carrots, and then use soup bones to make your soup flavorful. Okay, don't drink so much alcohol. If you're not someone who drinks, don't drink. But if you enjoy it, then only limit it to 2 drinks for men and 1 drink for women. Of course, people say they feel very happy sometimes when they drink alcohol. Too much alcohol is associated with head and neck cancer, breast cancer, liver cancer. And of course, the next one is mui hyong ham yi, salted fish, which is associated with nose cancer. Because I see head and neck cancers, I've also kind of shied away from eating it anymore. But sometimes when it appears on the table in the restaurant, or if you go to Hong Kong, I still eat it from time to time. Peanuts. It's not peanuts is bad, but sometimes if the peanuts are not fully dried, then they get a mold. And this mold is called aflatoxin. And this aflatoxin is associated with an increased risk of liver cancer. And, you know, lo and behold, sometimes our regular food can be contaminated with aflatoxin. This is a TV news from like 2014 saying that a lot of peanut butter, one of the surveys that they did in Taiwan, did contain aflatoxin. So when you buy peanuts, you really also want to make sure that it's in good quality, not moldy or wet. Of course, this is eating sireh or betel nut is a tradition that's dying away because it makes the teeth look so bad. But of course, there are certain parts in the world where people still eat this. And of course, up till about, I don't know, 10 to 20 years ago, Taiwan was still selling it quite regularly on the roadside. So this is associated with mouth cancer. And if you eat very little vegetables or your diet is mainly meat, then it's associated with an increased risk of lung cancer, mouth cancer, esophageal cancer, stomach cancer, colon cancer. And they've even done studies where if your diet is generally very bad, but then you decided to supplement it and eat more fruits, more vegetables, it can sometimes help decrease the risk a little bit. So eating vegetables is good even if your other parts of your diet is bad. So what is a good diet? Well, then the USA said the best overall diet is the Mediterranean diet. It's best diet for diabetes, best healthy diet, best plant-based diet. So what is a Mediterranean diet? Well, it's a lot of olive oil, beans, nuts, legumes, which is peas, red beans, green beans, seeds. Eat vegetables every meal. You should eat seafood at least twice a week. Eat less of cheese, dairy products, chicken, and eat much less of meats and sweets. Drink wine in moderation. What does an Asian version of the Mediterranean diet look like? Well, it looks like this: tons of vegetables. We are lucky to live in the tropics where we have so many different kinds of vegetables, and we should take advantage of that. So vegetables, greens, legumes, your dal, your vegetables, your soya foods, every meal. And all these things give you vitamins, minerals, fiber, phytochemicals. We don't even know all the things that we have in our vegetables that could be beneficial. So take the vegetables, not the pill supplements. Eat fish or shellfish twice a week. Eat less of eggs and poultry. Use healthy cooking oils. Drink more water and tea. And don't eat so much desserts. And too much santan also maybe is not the best. And so what is whole grain? They always say, oh, eat more whole grain. Well, whole grain is popcorn, corn, quinoa, brown rice, brown bread, barley, millet, oats. eat more chapati instead of our wonderful roti canai, roti prata, and all these buckwheat soba. All these are good stuff because they haven't cleaned it up so much. All our white rice, white bread, all that has less nutrients and probably is just plain old starch. If you're going to even add barley to your food, it unfortunately shouldn't be the Chinese pearl barley because that's washed 6 times and doesn't have a lot of nutrients anymore. Should probably eat like the Caucasian barley, which is less washed, and you have to boil longer. What about protein? How much protein? Well, you should only eat meat that is a size of your palm per serving, or that is equivalent to 2 small blocks of tofu, 2 slices of low-fat cheese, 2 glasses of low-fat milk, 3 eggs, and then the lentils, peas, beans, lentils. Those are full of nutrition. If you're someone who doesn't want to eat meat now and want to eat more vegetarian, then you must get your protein from these red peas, beans, hong tao, cheng tao, red beans, green beans, soya beans. All that is full of protein, and that's good for you. What about vegetables? Yes, eat vegetables, but not just green. You must eat all the different colors. When you go to the supermarket, go market, just keep grabbing so that your vegetable shopping is very, very colorful. So do that. That's good. And then healthy oils. Of course, we all use oil every day. We love to fry our things. Probably the healthiest oil starts from rice bran oil to canola oil. Palm oil, they keep saying, is not very healthy because it has a lot of saturated fat. Saturated fat decreases your good cholesterol, which is the HDL, increases your bad cholesterol, which is the LDL, and then increases your risk for heart disease, high blood pressure, diabetes, obesity, and all that. But there are good oils, and the good oils is omega-3. Omega-3 is not something that your body can make, and so you have to eat it. And this comes from sardines, salmon, trout, soya, nuts, and all these are good. Sesame oil is good. Maybe you shouldn't eat so much butter, although I love it. Coconut oil, palm oil, lard, and no trans fat. Trans fat is an industrial kind of fat that they put in a lot of cookies and baking. But I think even in the States, they've stopped that. And I think Singapore has also stopped trans fat. Okay, what about green tea? You know, in our Asian heritage diet, we say, oh, drink lots of tea. What is it? Well, some people say it's anti-cancer, anti-inflammatory, antioxidant. People can drink up to 3 cups of green tea. I cannot, I don't like tea. Contains caffeine. So sometimes it can, for some people, churn their stomach, make them hungry, give them gastric, make their heart beat a bit faster. For some people, it's like that. If you're going to do it, you should infuse it for 8 to 10 minutes. But does it really prevent cancer? Then actually we are not so sure. But if you like it, then drink it. So which green teas have the most what we call polyphenols? This is one of the chemicals found in green tea that is thought to be beneficial. Well, it would seem based on this slide, which is not very clear, that most of the green teas with the highest polyphenol content is from Japan, starting from matcha. Matcha all the way down to, I don't know what all this is, sencha, uchiyama. But of course, the Chinese tea also has a lot, and this is what we drink in a Chinese restaurant, tikunyam, and the rest. Okay, so if you want to drink green tea, go ahead. And of course, we have to look after our children, most women. We should try and not give them too much fried foods, which is this French fries, sausages, meat, and all these dried fried meat, possibly no good. Don't fry it, maybe bake it. Don't give them too many nuggets. That's quite a process. Eat brown bee hoon, eat fresh noodles. You know, we have to teach our kids also. Okay. Sometimes you look at things and they talk about anti-inflammation. Anti-inflammation means the body is just a little bit irritated, a little bit stressed. And so these are foods that could potentially reduce some of the stresses that the body feels because of all these bad chemicals. Maybe, you know, you work in a very stressful job and you're on top of calming yourself down through physical activities, you know, sometimes to calm the body down. So it's the same as any healthy diet that we've been talking about: tomatoes, fruits, nuts, olive oil, eat lots of greens, eat a lot of fatty fish, and then to eat less of all these fried foods, sodas, white bread, and lard and processed meat. So it's just a healthy diet here. And of course, hawker food is Singapore heritage. It's our right to have cheap hawker food. But of course, you know, hawker food isn't the healthiest as well. So maybe instead of eating roti prata, you should try thosai, which is also very nice. Shouldn't eat just fried chicken, maybe try grilled chicken instead of fried chicken. Maybe tandoori chicken is healthier, and not everyday laksa. It's good to have a bit of cheng teng, and then maybe even fruit rojak is not as healthy as fruit, but it's better than some of the other fried fruit desserts. And of course, I love my sweet tea, but of course it has a lot of sugar. So you have to swap a little bit if you eat a lot of hawker foods. Don't use a lot of dietary supplements. We don't like that. All doesn't protect you against cancer. And we've done many studies before, and there was one study in the States, well talked about within our circles. They took a group of men without cancers, but they were all smokers, which means they're at higher risk for cancer. They gave half the group beta carotene, which is like antioxidant, it comes from like carrots, and the other group, they didn't give them any beta carotene, and the smokers who were on high on beta carotene had more lung cancers. So if you're not starving and you have enough nutrition, we don't like people taking high doses of antioxidants and this and that. We prefer that you take your nutrition out of foods rather than pills. This is another study. Usually when patients, when they're on chemo, they always ask me, oh, can I take this? Can I do supplements? Can I take this and that? I'm usually not so strict, but this is a study that came out last year. And this is a study of about 2,000 patients. And these people were breast cancer patients going to undergo chemo. And they made them say what supplements they were taking. And in this study, they said that if you were taking higher doses of vitamin A, vitamin C, vitamin E, carotene, CoQ enzyme, taken before and during chemotherapy, that these patients had worse outcomes. And some of the other supplements, vitamin B12 and iron supplements, also had worse outcomes. People who were on one regular dose of multivitamin did not have worse outcomes. And so because of this study, I'm slowly starting myself to be stricter when the patients ask me, hey, can I take this? Can I take that during chemo? My answer is like, no, unless they have some nutritional problem. If they are healthy, which is what most of my patients are, I would say, don't take it. We are beginning to think that really it can influence outcome, and maybe for the worse also. Okay, don't take a whole bunch of very high doses of herbs. I don't know what some people do. If you go and take like 补肾 tea herbs, which we eat from time to time in our own households, the 1 or twice a week, we eat herbal, I think that's fine. But if you're going to take herbs for the purpose of treating cancer and you take high doses of something, I don't know, but Sabah snake grass is a herb. And some cancer patients heard that it's good to cure cancer, and then they will take it. But this one, if you take it in large amounts, can drop your hair and drop your blood counts like chemo. So I really, whenever they talk to me about it, I'm like, no, cannot absolutely do it. I don't like it at all. So just to tell you, there's a variety of herbs that maybe you shouldn't take in large quantities. I'm going to spend like 2 or 3 slides about what can we eat during chemo. That's quite a common problem. So during chemo, we want you to eat enough calories and protein. Please don't change your diet drastically, because most of the people that come to us are healthy. They did not get their cancer because they ate wrongly, even though sometimes we say there's a link between cancer and diet. We don't like when you're on chemotherapy for you to suddenly change your diet drastically or have something really restrictive. We don't like mega antioxidant diet, mega vitamin diet, no meat diet, no, don't eat sugar, don't eat salt. We don't like any of this. We don't insist that you eat meat because meat is good, but we insist that you eat some protein. And for most of us who are not vegetarians, meat is still our main source of protein. If you think, oh, now I want to change my diet to less meat, you must replace it with eating the vegetables that have protein. And these are the red beans, the green beans, the dal, the legumes. You have to eat that, because if you don't eat that and you don't eat meat, I tell you, people can have trouble during their chemo. They just don't recover as fast during chemo. We also don't want you to, if you don't eat enough protein, you will lose your muscle mass. And that's what makes your body weak. And we don't like that at all. So, but let's say you are doing chemo and you really like are having problems with your appetite. So then we ask you, you must eat small, eat frequent. And if you are in that kind of situation, don't eat your rice. You must eat your vegetables and your fish and your meat first. Then after that, for pleasure feeding, you can have your 3 tablespoons of rice. Because if you're not eating a lot, you have to push the good stuff in first. Good stuff looks like peanut butter, avocado, olive oil, I don't know about coconut oil, fish, all these are considered good, dense nutritionally foods. Sometimes the doctors will give you some nutritional supplements. These are not the ones that you buy off the shelf. And of course, when you have a meal, have it with friends so that, it improves your quality of life. The other one is sometimes during chemo, you get these bad mouth ulcers, and then it's a chore to eat again. If you're one of those, then you have to eat the soft, like the porridge. Don't have a lot of spices in it, very bland, probably chicken breast. We can give you nutritional supplements. Use a straw so that you don't burn your mouth so badly. Some people like it cold, some people like it hot. Don't use harsh mouthwash, especially those with alcohol. It dries up your mouth and makes it worse. Some people on chemo cannot take chili because their mouth becomes sensitive during the chemo. Baking soda and salt water rinses, you can get this off the Google. That's one way of doing it. The other ones are neutropenia. Neutropenia is a medical term. Is when your immune system is down. We like your foods clean. So we tell people to wash their hands when they cook. Even if the salad is washed, wash again. Wash with boiled water if you're fussy about it. Cook foods to the proper temperature. Don't have half-boiled eggs. Everything must be cooked. Everything must be pasteurized. No taking of raw milk and making your own cheese. No raw beer. Don't eat at buffets because we don't know how long the food has been there. So these are general guidelines. Dysgeusia or ageusia is the medical term where the taste is bad. Somehow when you're on chemo, the taste is metallic, it's bitter. So what do we have? We tell you to rinse your mouth with baking soda and salt. Use plastic utensils instead of metal. I've tried it. My patients say it doesn't work, but it's one of the recommendations. Use lots of herbs, spices, marinades. Play with flavors, whichever works for you, sweet or salty, but of course not too much salt and sugar. And some people say zinc supplements, but the few I've tried this with also all maybe not very good effect, but it's out there as a possible help. So in summary, diet can influence your risk of developing cancer, but you shouldn't use diet or special foods to treat cancer. Make sure you get your vitamins from food and not supplements. There is no better diet for cancer survivors than a healthy, balanced meal. Many patients ask us, we say, no, just eat lots of fruits and veg and less of meat, and that's the best diet you can have. Now, because food cannot prevent cancer, no matter how rigorous you are about it, please go for cancer screening, breast cancer mammogram, pap smears, and colon cancer screening. The government does a great program, and many NGOs also help out with this. Singapore Cancer Society, Breast Cancer Foundation, they offer tests which are sometimes at a much cheaper rate, and you should take advantage for it, because for you, it's just a test. For all of us, including government, there's huge money sunk in for these kind of programs to make sure the testing is good quality, the results are not missed. So please engage in these cancer screening programs. Okay, healthy diet, eat lots of plants. Potato is not a plant. Eat lots of colors. Eat whole grains, the brown stuff. I'm not a great lover of brown stuff myself. I don't like brown bread. But I found this bread, it's called Canadian, I don't know what, pre-sprouted bread. I don't know how whole grain it is, but it's soft and nice like white bread. Cook vegetarian meal once a week, eat much less meat, or better still, now you see in the supermarkets much plant-based protein, which is using plants like a burger. I've tried the plant-based luncheon meat. Looks like it. The texture is like luncheon meat, but the taste isn't exactly the same. So maybe giving them a bit more time, they can get it done. Avoid processed meats. Eat seafoods at least twice a week. Those with a high omega-3 is sardines, salmon, trout. Avoid alcohol. Avoid sugary drinks. And don't drink too much milk. Not too much. 1 glass is okay. And what else now? Okay, this is probably not us so much, but I think it's going to be what the next generation really does look at. The world and the climate change is really coming up to a head. And many people feel that changing more to a plant-based program instead of clearing a whole forest to feed cows for McDonald's and the rest of the world, many people feel that really, even though farming has its own carbon footprint, really eating more vegetables rather than having more and more meat is the way to go. It says by eating just a Mediterranean diet, which is not a full vegan diet, you can reduce greenhouse gas emissions, reduce land use, reduce energy consumption use, and reduce water use. So there really is something to this whole thing. And I think as Singapore has rolled out its green program, I think they're going to say they want all electrical vehicles by 2040. I think in Europe, they're aiming for 2030. This is also, I think people have, maybe not us, but I think our children or even the next generations, they will maybe eat less meat because now it's becoming popular as well. Of course, cooking can be therapeutic. Please eat with your family members and your loved ones. Enjoy cooking sessions with your grandchildren. And so that's this is my last slide. Thank you very much. And do your bit to prevent cancers. Thank you.
Thank you, Dr. Ling. There are tons of questions about food. We'll come to those in a moment. We welcome back all our doctors as our panelists, for the Q&A. Where do we start? Let's talk about food then, since we're on the hot topic.
Oh, no. Okay, fine.
What is margarine? Is margarine good?
The reports have been so mixed. For a while, when I was growing up, margarine, vegetable oil was much better. But recently, they've been, I don't know whether these are just lobby groups lobbying for their own industry. But they also say that butter is also quite good, and so I like butter, and I do. But in moderation, I really feel so. And although I say this is good, this is bad, but the truth is you really have to eat a balanced diet. I don't think there's any food in the world that's very, very clean these days. Even fish is not that clean. I think you really have to keep rotating your foods round and round. I eat butter. I love it. But maybe if you eat that, better than eating lard. So eating butter is better than eating lard. But eating another kind, olive oil, maybe is better than eating butter. But yeah, I feel it's okay. It's okay. It's not like smoking.
True. The composition of butter itself is basically milk, and then, they churn and churn and churn, right? I think one of the things that they look into it when you buy butter is look at the components, all right? So for me, I have learned that I would use some of the butter that has high percentage of rapeseed oil. I know what's the oil that they're using. Instead of, if you see a high percentage of palm oil, I don't touch them. Most of the margarine, if you look at them, they're actually a very high percentage of palm oil. And that's why the trick of, or rather, the thing about health is that the more natural food you eat in its natural way is better. That's why sometimes, even olive oil, if you dip your bread in olive oil, it's better than having butter. So that's why see what you have, knowing your ingredients and what is the made of it. You are subconsciously consuming a lot more palm oil than you know. I'm not a lobbyist against palm oil whatsoever, but statistically, they just show it is not an extraordinary good oil. And so know your food, what you are eating and things like this. The other question they have is that, and I'm not sure really, Dr. Lim is young. I would expect a 70 or 80-year-old woman answering this question, and I think she's too young to answer this question. Is this, what's the difference between the Chinese and the Western barley?
Oh. I mean, all of us grew up with the dessert Chinese barley, but the Chinese barley, which they call pearl barley, has been washed 6 times. So although it is a grain, it becomes like a rice again, white rice is missing all of its great nutrients, and it just becomes like starch, which is not so good. You should try probably the Caucasian barley is a bit better, or the health food barley is a bit better.
Yeah. I think it's also, what you're doing, in moderation, everything in moderation. Of course, compared to, I think the sugar level of barley is probably lower than rice, if you mix into it, and then it's different. And what you use it for, and it's not a meal supplement, changing it over rice, but, putting it in different type of rice, it gives it that flavor. The other question is that, should they use egg white as protein?
Absolutely, there is protein in egg white, but nothing wrong in eating the whole egg. Singapore is on a no food wastage program also. So unless you have some specific problem, eat the whole egg, I think.
I think egg is one of those, except for vitamin C, it has all the nutrients, all the minerals, and all the vitamins except for vitamin C. It's a very good, actually, if you ask me, eggs is a very good meat supplement, which means if you don't like meat, you actually eat eggs and you can have eggs, And some people, they felt that they're eating too much bean curd, they may have uric acid or whatsoever. Eggs does not give you that. So that's one good supplement for eggs. The other question they have here is that, why do we limit dairy to 1 cup of milk a day?
Yeah, dairy is a wonderful source of nutrients. Definitely we would give it to kids, but as you get older, maybe we don't need all the full fat milk, that kind of fat. Usually if we tell adults to drink milk, it has to be low fat or skimmed, unfortunately, but it doesn't taste as nice, of course. Yeah, but it's just the fat, it's the whole calorie content thing. So adults, we should drink skimmed or low fat milk, but then of course it's just like drinking white water.
It really depends on whether you're drinking them or putting in your coffee. I guess nobody would. I'm sorry, but then I think, it does discount the taste of the coffee when you have, skim milk for that matter. Just one more thing, I think there was a confusing part in terms of peanut butter. There was a slide earlier on to say that, there is probably, what do you call it, antihistamine or something. And then in the later part, that's one of your good food. So, I think we need a bit of clarification here.
So just I was saying, it's important to kind of know what exactly is in your food, and also where it comes from. So I hate to talk about all these things, but let's say if I buy peanut butter, I try and buy it from like Australia and try and make sure at least it's made, because I feel Australia's standards are just very, very good. If I bought it like, I don't dare say other countries, but if I buy from countries where the origin of the quality control is not that big, then I'm also, maybe I should just spend a little bit more money on countries where their quality control is quite good and buy it from there. Peanut butter, I do look at it, and I try and buy Australian things sometimes. I hate to say this, because simply I think that the country has better quality control over their food. Yeah.
I think it's true.
Yeah, if you go to the shops where you buy peanut for your soups, which I do all the time, I do look at it when I'm buying from the dry sundry good, exactly the peanuts. They don't tell you where it's coming from. But yeah, at least make sure it's clean and not moldy or left in the warehouse for like 3 years, then they took it out, that kind of stuff. But it's good, it's good food. But but I'm just going to say one more thing. If you're going to buy nuts, it's better to buy the nuts on the trees, which is the walnut, hazelnut. Peanut is a nut, yes, it's a good sort, but it's not as healthy as walnut, hazelnut, macadamia nuts. So it's a good oil. It's a good oil to fry your things into, deep fry. It's got a good smoking point, and it's reasonably high in unsaturated fats. Yeah.
So the cycle is from the tree to the harvest to your plate. It could be 2 years for nuts.
No,
It could be 2 years.
Oh, that I don't know. I don't know what is the cycling of coming,
Yeah.
but I'm just saying, if you think that the nuts, maybe in some countries or the providers where they harvested the nuts and then they put it in a warehouse for 3 years, you really don't know what the condition is, then those you would be worried about.
Likewise, it's the same as wine. If it's a good year, the grapes is great, the wine harvest is good. If the nuts is produced in a certain year where there's an overproduction, then sometimes that's the concern. So this is just a broad stroke for all of you for consideration. Okay, let's move backwards and we look into questions on one of the questions about cervical cancer. So one of this is this, what is considered previous breast condition? Dr. Lim Yuan.
Oh yeah, so some certain conditions like what we call atypical hyperplasias that's seen on like people who have like biopsy on like lesions before, and they have this diagnosis of atypical hyperplasia. So these people may have like some slight increased risk of getting breast cancer in the future. That's what it means by previous breast conditions.
I see. And for women, for screening, is it only recommended for breast and cervical cancer for up to 69 years old? What about above 69 years old? That's one. And do women above 70 years old need cervical screening, which is the same question?
Right.
And is it usually women? I think the vaccine part is one question. Well, first, can they claim by Medisave? Second is that I think the vaccine we need to clarify, with a little bit more, is that someone actually with already sexual experience and things like that, do they still need the vaccine, etc.? Dr. Lim.
Okay, maybe I'll go through the age for the screening first. So for cervical cancer screening, it's recommended up to age 69. So if you have already had 2 negative HPV screening tests before that, then your chance of getting cervical cancer again after the age of 69 is quite low. So you can stop at 69. For breast cancer screening, for women who actually remain well above the age of 69 and they have still got quite a good life expectancy, we can still continue on with breast cancer screening.
So screening is for cervical cancer 69. If they have 2 previous ones, that is good. And there isn't any follow-up from the doctor that asks them or family history, etc. They can stop the regular screening for cervical cancer. And then for breast cancer is that they can continue as long as this on a yearly or 2-yearly basis after the age of 69.
Yeah, if they remain physically well.
Yes, thank you. And of course, those symptoms that Dr. Lim has mentioned earlier, if they do show, please do see a doctor. The age is not the green pass to say I don't need to go for it anymore, but really it depends on your body. And what about the vaccine? The Gardasil vaccine 20 years ago, should they still go for the Gardasil 9 vaccine now? Is 51 years old.
Yeah, so I mean the vaccines actually, I mean, as far as we know, they actually give quite long-lasting protection from the data that we have. So and the difference between the old Gardasil and this Gardasil 9 is that Gardasil 9 will cover a few other HPV strains. For example, like they will cover also, because the old Gardasil will cover 4, which is 16 and 18, 31 and 33, whereas the Gardasil 9 covers a few other HPV virus strains, and also 31 and 33, which also protects against genital warts. So recommendations for Gardasil 9 is up to age 45. So I mean, if you're already like at 51, I guess, I mean, there's not a no that you can't have the vaccine, but it may be good to just discuss this with your gynecologist.
I see. And what is a HPV test, and can you use Medisave?
Yeah, so the HPV test is actually, it's a test for the human papilloma virus. So this is also done together at the same time when you go for the procedure, like when you get the pap smear, they will also get this, some swab from your cervix, and they will send this swab material to test whether there's HPV, high-risk HPV present in the cervical smear, in the cervical swab. So it is part of the screening recommendation recommendation from our health promotion board, and it should be claimable with MediSafe.
Okay. And for breast cancer patient at stage 1, after having a breast surgery, what would be, the chances of them getting the COVID-19 vaccine?
Sorry, after breast cancer surgery?
Yeah, breast cancer surgery, after breast cancer surgery in February, which is like last month, and, is it advisable for them to have the COVID-19 vaccination? And when is the appropriate time?
Yeah, so I think this will also be best to be discussed with the doctor, because after breast cancer surgery, whether there's any additional treatment that would be needed. So I think it would be best to discuss this with the treating doctor.
Thank you. The other question I have is Dr. Nisa. Dr. Nisa has been sitting there, and it was our first speaker. Dr. Nisa, with recent advancement, you would say that the treatment these days that we have for cancer patients is better than 5 years ago?
Definitely yes, because we have much more options of treatment. And also, it's been clearly shown that the improvement in survival across the different types of cancers has also improved, the 5-year expectancy. But I would say, although we think about treatment of cancer as important, I think prevention and early detection saves much more lives than we can improve cancer care by preventing it or detecting it earlier in the first place. Because if the earlier you detect cancers, you may need less treatment, you may just need surgery, you may just need a polypectomy, rather than having to go through big surgery and chemotherapy and radiation therapy. So we want to prevent that stage rather than focusing all our efforts on advancement of already developed cancer. We should do both, but where it really matters is prevention and screening. So you don't have to go through all the tough treatment, later on.
Is there any screening for lymphoma?
Sorry, I beg your pardon?
Is there any screening for lymphoma?
No.
There's no screening for lymphoma.
No, there's no screening for lymphoma. It's neither general population or individualized. There's no screening per se for this. So not all cancers can be screened for, and this actually depends on whether if you screen for earlier, whether it benefits on the population level, and also if you do screen, does it make a difference in terms of the cancer outcomes, and also how common a cancer is. So you shouldn't screen for cancers which are not, for example, in the top 10 cancer list in Singapore, for example. So these are the factors. But for lymphoma, there's no screening program for this.
Is there a high percentage of people getting lymphoma in recent years?
There has been increase, but it's not, I wouldn't say it's high. It has not made the, and it also depends on the age group which you're talking about. So it's more common.
50 and below lymphoma, has this shown an increase?
So if you look at the incidence in younger patients, actually the more common cancers are, for example, lymphomas, leukemias, lymphoid and myeloid proliferative diseases. These are more common compared to the ages which I mentioned earlier. Yeah, but it's not been a drastic increase or anything like that.
Okay, and it could be due to screening that people are more aware and they go for checks and things like this. So
I think general health checks, but not screening for lymphoma. We don't do screening for lymphoma.
Yeah. So, but when they're going for health screening, like a lot of them, they have work health screening, and through the screening, they will have picked up some of the symptoms, and then they will continue to follow up and have those checked.
Yes. So if they have a blood test done to show their blood count, the red cell count, white cell count, and platelet count, for example, then if you do pick up abnormalities, then these are followed up. But these, I wouldn't say these are screening for these things. These are, you look at, that's a general health check rather than a cancer screen, I would say. So
theoretically a byproduct from a health screening, that this becomes onto the radar, and then they could follow up with other checks.
Correct. And also this health screening is recommended by the Ministry of Health. If you look at your own personal health hub page, you can actually look at what is recommended for you. So between the ages of 30 to 50, there are some health screening checks, and these are actually health screening checks for chronic diseases. So not cancer specifically, but regular health check in addition to cancer screening if you fulfill the right criteria of age and risk. But yeah, health screening for example, chronic diseases like diabetes, high blood pressure, and things like that.
You mentioned it's from the healthhub.gov.sg.
Yeah, it's you can actually see what's recommended for you at the Health Hub.
Okay. Okay, so one of the question which I've asked earlier is that is there a significant higher number of cancer cases in Singapore compared to the 90s? I believe you've answered that question. Sorry, the questions are. It's a very specific questions. Do you think the environment has anything to do with our increased number of cancer cases?
It's undeniable there's been change in the environment, but I would also say it is also the move to more screening. As you screen, you pick up more patients. So I would actually look at, one is incidence, but also you have to look at the stage of cancers, because when you screen patients, you actually detect earlier cancers in the earlier stage. And although it appears that you have more incidence of cancer, you may find that your cancer mortality is going to improve. So, the outcomes, how many patients pass on from cancer, that actually decreases when you pick up patients in the earlier stage. So it's quite a complex topic when you talk about how screening affects the incidence. Because if you never screen for cancers, you don't pick them up early. Whereas if you screen them early, you have a higher number of patients diagnosed with cancer, but all your population lives longer as a result. But to answer the question, definitely environment has a factor. It always has. Also that we are living longer, right? So we actually, the longer age is the biggest risk factor for cancer. If you see, the older patients are more predisposed, and the older the older you are, you have more time to develop mutations in your genetic makeup, which will result in cancer. So it's complex.
Yeah, it's complex. There's a lot of factors other than hereditary, environmental. It's also because we're living longer. So the mutation, whatever it is, has longer time to develop to becoming cancer. But at the same time, early detection will also mean that you're going to be cured and you can still have quality of life. So ignorance is not bliss, but having the screening and getting it tested, knowing it, getting it treated, there will still be good quality of life. And in fact, a lot of them actually live a very healthy life after that, and a much more quality life, having that spectrum of looking at it. There's rare cancer, sarcoma. Yes. Does the prognosis always poor?
So
what kind of cancer is that?
So sarcoma is a group of cancers arising from the musculoskeletal system, but it's also a group of cancers which vary in their prognosis, and you can't really give an overall prognosis that covers all of them. So I think you actually need to discuss the specific prognosis based on the type of cancer, the stage of cancer, with your oncologist. So it would not be very accurate to give a general picture of this. Yeah, that's what I would say.
I want to ask this question, is this, as a doctor, as a hematology oncologist, all right, what to you is the star patient? I think, you get a lot of challenges from your patients. Can I eat this? Can I do this? Can I do this? So in a doctor perspective, what to you is the star patient that you think, as a doctor, you would like to work with a patient this way because this is actually increasing their chances of recovery?
So actually, if I would prefer to not have any patients because no one has cancer.
Thank you.
But if there is this situation, then we would actually want patients who, and I think the same way patients want doctors who we work together as a team, and I think we listen to each other and we decide, make shared decisions about what to do next. and be open, and even there's things that you disagree with, that you have open discussion about it, and you be honest about things that, for example, that you're doing or taking, or complementary medications that even if you are doing it, that at least is known to the medical team. So I would say being open and being proactive, and having open discussion and shared decision making would be what I aim for.
Okay, thank you. Thank you very much, Dr. Nisa. We'll come back to you in a moment. The other question we have here, we have lots of questions actually, and they are all quite a lot of food questions, which we would have to, come to them a little bit later. Immunotherapy. What is your take on this? And what kind of cancer actually would benefit a lot from this immunotherapy? Immunology therapy, yes. Dr. Nisa.
Yeah, so again, this is a wide topic, and it's new and evolving, because actually it's a treatment which stimulates the immune system to fight the cancer, put simplistically. And its role in cancers actually is evolving, because as we find it works in one cancer, we continue to try it in other cancers and in different stages. And we're actually very encouraging results with immunotherapy, because it helps to actually result in long-term disease control in patients, even with advanced cancer. So it's initially shown to be very effective in melanomas, and then lung cancer, and followed by other types of cancers as well, especially in cancers where there is genetic abnormality that prevents DNA repair. But again, although these advancements we're talking about improvements in cancer care, and these are the sexy and exciting sort of developments that we have, I would always remind ourselves that we want to prevent it from reaching this stage in the first place, where you don't need immunotherapy. That the prevention and screening are even more important than these developments, because although we feel these are very exciting, and as oncologists we're very excited about helping patients in an advanced stage, we also have to remember that we want to actually prevent it. Prevention is better than needing these treatments.
Thank you. Yes, the key word here is prevention is better, and knowing it early and you seek treatment is also good.
Correct.
Thank you, Dr. Nisa. One question here we have is, what's the difference between a mammogram and ultrasound? Do we need to have both? Dr. Lim Yuan?
Yeah, so I mean the mammogram is what we use for screening for the breast cancers, and if we do detect some abnormalities, then we might go on to do an ultrasound of that specific area to look closer at the specific area. So ultrasound is not a recommended screening method. It's mainly a more targeted scan looking at specific areas.
I see. So after mammogram, if there's any target area that we were looking for, we actually, or the doctor will order for ultrasound.
Yes, the doctor may order for ultrasound. Or for example, or other things like to doing the ultrasound is, if you have detected like a mass and it's not detected on mammogram, but doctors may also order an ultrasound to look specifically at the area whether there are any abnormalities.
Okay. That's a very interesting question, and I'm curious too. What's the difference between a hematologist and an oncologist? And which is recommended for lymphoma patient and why?
Yeah, so a hematologist treats like blood cancers, like leukemias, and also like lymphomas also fall into the what the hematologist would treat. Oncologists would treat more like solid cancers, like breast, lung, colon. But I think lymphomas can be treated by both oncologists or hematologists. But the hematology actually does do a lot of lymphoma treatment.
And, some breasts has calcified lumps, and are they recommended to be removed to prevent them from being cancerous?
So you will need to like investigate the lumps first, and then usually the biopsy would be done, and we would see what are the changes that are noted in the breast, and whether these would need excision or removal.
Okay, thank you. Quick questions. Bladder CA stage 1. Is it still suggest or rather encourage, they live a normal life, including a happy married life? Who will take the question? Dr. Nisa. Let's pose the question to Dr. Nisa. Dr. Nisa.
So I'm not clear, I understand it, but I would say as long as you are seeing a doctor and getting appropriate treatment for the bladder cancer, I think life can carry on as per normal. But the big caveat is you must be on, must have received appropriate treatment for the stage 1 bladder cancer.
I think it's one important thing is that your relationship with your doctor should be good. And then, you can ask your doctor questions, pretending to, sorry, I'm probably going to rephrase this, a lot of time we see questions being posed because sometimes people felt awkward asking their doctor whom they see face to face with a name, and they will ask during a forum or go to Google search and things like this. But your doctor and you should have a good relationship with it. You should ask the questions because your DNA is unique and your condition is different from the rest of the people. So asking questions, for example, should I take the vaccine or should I continue, my sexual life and things like that? You should be asking your doctor because your doctor know your history and will be able to provide you answers. But in general, like what Dr. Nisa has said, as long as you've got a clearance from your doctor, it shouldn't be an issue at all. Next question we have is Dr. Lim Yi-wan, constant itchy on the nipple, is it a skin problem? Is it linked to breast cancer?
So actually, this one usually you will probably need to see a doctor for examination because and that would probably be better assessed. But sometimes it may just be skin condition, but it's better to see the doctor for a check to make sure there is nothing more sinister.
Yes, and sometimes I've known people where they have so-called, they thought it was pimple around the breast. And then they say, oh, it's too hot, too heaty or whatsoever. But actually, it's a big siren. They should see a doctor. And if you go to a polyclinic and you felt that, you want to see a lady doctor, just ask for a lady doctor and not feel embarrassed about it. One question for Dr. Lim Yi-wan is, we say processed meat, like luncheon meat is not good. What about tuna fish and sardines, Are they still also laced with sodium nitrate?
I think the ones in the can, like the ayam sardines, they are not salted, they are not cured. They're actually cooked and canned in a sterile way. I wouldn't count them as salted foods. In fact, they're quite a good source of omega-3 and they're quite nutritious. So go ahead. The only thing about tuna is it's a huge fish, and huge fish, if you eat too much of it, they carry a lot of mercury in their fat because they've lived a long time. So tuna probably in a can is okay, but if you eat like tons of tuna, sashimi, yellowfin, whatever, then you can't eat that much every week. Tuna actually in its fresh form is actually, in its big fish form, has quite a lot of mercury in the fat.
So deep sea fishes, you mentioned that, it may be healthy, but again, it may carry a lot of mercury that's from the deep sea.
Yeah, if they live a long time. Sardines is absolutely fine.
Okay.
Even the canned tuna is not bad.
So does antioxidant fruit clashes with chemo and RT treatment?
Yeah, I've asked my colleagues, I've asked my radiation doctors, what do you think? And most of them think it's okay. But the flip side is we don't have strong studies to say that you cannot. But a lot of our chemotherapy and our radiation therapy, we kill cancer cells by producing these things called free radical oxygen. And if you leave it up to me, I really would prefer you don't take high doses of mega vitamin and mega antioxidants during during chemotherapy or radiation therapy, although we don't explicitly say so. Plus a study from last year, I think people are starting to think these kind of diet supplements, no matter how healthy it is, don't overdo it. It may not be the best. I wouldn't. If the patients ask me directly, I would say no. But when I ask my radiation colleagues, they don't say anything. They say, okay, what? So I think it's not certain, but I would prefer if they don't.
So RT means radiotherapy.
Radiation therapy.
Radiation treatment. And I think a lot of them is like, if you have your regular dose which you used to have, that's fine. But if you're like thinking that this is some special or magic medication and you have the large doses, including like a Saba stick, I think we need to differentiate sometimes herb versus tongkat ali, that kind of thing, which is what we call the R medication. It's not really replacement therapy or alternative or TCM. And the main focus when you're seeking treatment, focus on it first, because when you have too many disruptions, it's hard to pinpoint what is causing your symptoms, your discomfort, etc. So focus on the treatment, and then after the treatment, when you're in rehabilitation, you're gaining your health, you can start introducing proper food. I think your diet is important, like you mentioned earlier, because you have a change in your taste bud and everything. It's more important to put in the good food, the one that has nutrition in, before you start eating the rice. But I can also understand why they eat the rice, because the rice is probably the one that has no change in the taste, because some people would say that, the taste of all the food tastes like sawdust or tastes metal or tastes otherwise. So they pick the familiar food that the taste is still there. Some are very sensitive to sweet food, and rice is sweet, so this is continue to have that. But these are some of the reasons why the doctor has said that eat the more nutritious one, so that you at least have all the nutrients to withstand the chemotherapy, the radiotherapy, and all the treatment, and feel better and at least have the energy. Last question we have, let's see. We have lots of questions, and some of the questions we could answer here, and some of them we can't, and we apologize for that. Lung cancer. This is always a question, and a lot of people hit with lung cancer, they felt very cheated because they do a lot of screening. So lung cancer has no screening. And doctor always said the best prevention is to stop smoking. But we also see a high number of people who are non-smoker and they have lung cancer. And again, they felt like I have lived a healthy lifestyle, eating well, and why do I get cancer? So as one of our parting words, Dr. Lim, I'm going to put you on the spot since you're the main frame, What is your advice, in this instance, as a doctor?
People feel cheated. Okay, so I don't treat a lot of lung cancers, but I'm going to tell you the majority of my patients are all very healthy people at the prime of their life, doing well in their career. And so cancer doesn't always discriminate, and rich or old, stress or not stress, whatever, everyone is liable to get cancers, and even doctors too. So over in the West, where the smoking rates are much higher in women and men, then most of their lung cancers are tobacco related. But over here, the smoking rates are very low in women, but still we see quite a lot with lung cancers. And so I don't know what to say. There is a luck of the draw. I have many patients who keep asking me, why did I get cancer? I also don't know. We only know that there are certain risk factors, but we can't tell. We can't tell fully. We can only say minimize the risk factors and live well. Be happy also, because really it is not a guarantee, even if you are vigorous about your health, that everything will be okay. Sometimes health is a gift, I feel. Enjoy your days.
So would you think that, the mindset and the psychological part is actually important to fight it?
It's very, very important. You can't be healthy if you are mentally unwell. So we have many people who are unwell physically because of this and that, but somehow they are happy, they are resilient, they are contented, they have good days and bad days, but they are okay. And we have also many healthy people in our clinic who mentally it's stressful, they are anxious, and although they are healthy, they behave like they are sick. So I feel very strongly to be healthy, you need both. You need to be physically healthy. You also need to be mentally healthy. And once all the treatment is over, and if they do need emotional help, emotional support, I do spend some time on it. I think it's part of being healthy, you know.
And part of the medical consulting team also, they could include psychological help or counseling for everyone, you know, to overcome. And you know, other than they do financial consulting, they also do mental consulting, and there's nothing wrong with it. And also for the caregiver, they also need a lot of support and help. Just any parting words from you, Dr. Lim?
Okay, so tonight when you cook your rice, throw in half a cup of red rice, wild rice, barley, red bean, green bean, whatever. I love white rice. I'm not a great lover, but whenever I have red rice, then I'll mix it. I won't eat it on its own. I actually don't like it, but you know, it's good for you. Have to do something. Even if you mix in barley, that's still better than rice, I feel. Enjoy.
Thank you.
Yeah.
Yes, I do put black rice and all the others to mix with white rice, basmati rice, so that, you know, just to have a mix. And you feel healthier when you look at that bowl. So, you know, you have to eat it, and might as well you eat and feel happy. Dr. Lisa, any last parting words for today?
Maybe just two things. First thing is moderation is everything. Everything in moderation. And second thing is early detection and prevention is better than treatment.
Thank you very much. Yes, everything in moderation, all right? And treatment, you know, get your screening done. And remember, we have a memo bus on the 21st of March. So do join us and come to the talks. You know, knowledge is king here. Thank you very much, Dr. Nisa. Dr. Lee Yuan, any parting words for our people that's still in the audience?
Remember to go for your screening.
For all the ladies, remember to go for your screening. And for all the gentlemen, you know, a lot of breast cancer are actually detected by the partners, not themselves. So, you know, have fun. And, you know, thank you everyone for this weekend. Let me see if we have other messages that is coming to. Thank you again for all our speakers, which is Dr. Lim Ziwing, Dr. Lim Yuan, Dr. Nisa. And for all of you who participate, please don't go yet. We have a survey coming up after this. We'd like to thank our partners, Singapore Cancer Society, 365 Cancer Prevention Society, our sponsors, MSD, Pharma, Pfizer, Roche, and thank you for making this event possible. Remember to visit our website on the NCIS Ribbon Challenge.sg. and tap the ribbon to show your support, especially during this difficult time for some and also for our healthcare workers. And please do stay on for the poll for your feedback, and it will be an online feedback. With this, we thank you all for your participation this morning. Live healthy, be safe, and we'll see you next time. Thank you, everyone. Thank you all the doctors. Thank you all the people that's working at the back end, you know, all our volunteers. Thank you. Have a good weekend.